So it gives me great pleasure today to welcome Dr. Sonia Karani, who's a PhD researcher and physiologist at ASV Santé and the Pediatric Non-Invasive Ventilation and Sleep Unit at the Necker University Children's Hospital in Paris, France. Welcome, Sonia, and she's going to be giving us some top insights into the considerations about choosing equipment in children. When would you swap from a nasal mask to an oral nasal mask or back the other way?
So to answer this question, we'll look through this slide. This is a diagram that I borrowed from the GAVO2 group from the French Society of Respiratory Disease, from the respiratory therapists. This is a very, very nice slide, I think. So we'll go through this to try to understand when we need to change the mask or to adapt something. So just to start, usually for infants or children, we have the habit to try to adapt first nasal mask, just because once again we have choices compared to facial masks for infants or for young children. This is another problem for older children, and just because we think that when you start with a CPAP or NIV, it can be better tolerated, better accepted to try with a very small kind of mask that is like nasal mask than to start with a facial mask. But if you see, when you see the child and you speak with the parents or the child, that the mouth is always open during wakeful time, you may think that during the night that will be the same thing. So if the child is bigger enough, I mean the age of the child, you will want to try with facial mask directly. But so what is the first thing to ask is that, does the patient breathe easily through the nose? You can ask the parents. Sometimes you can't ask the child, obviously. And if the child is big enough, you can try to ask him if he has some difficulty to breathe through the nose or not. And if it's not the case, you will want to try to start with the nasal mask or nasal pillows. Usually, to be honest, we will try with nasal mask and not with pillows, except if it's like adolescents as a first intention, just because you may think that you will receive too much pressure, and just as an initiation of CPAP or NIV, maybe it's better adapted the nasal mask. But if you want, you can try directly pillows for older children or adolescents. And then you have many choices of nasal mask, especially for older children. You can try this new type of nasal mask that are under nose nasal mask, or once again the pillows. And if you have persistent leaks, bad tolerance, you will have the possibility or to try to readapt the mask or to change the mask model within the same type of mask, with different type of mask that mean trying a facial mask if the child is bigger enough, and go for the second choice mask, as we said, exceptionally if you don't have the choice. If you have persistent mouth breathing, I think that one of the first intention is to try a chin strap, because it can be better tolerated than trying directly the facial mask. But once again, you have to see with the child, sometimes also with the parents, what they would prefer to try, because sometimes they don't even want to change, even if the mask is not adapted. So you have to try to convince them. And sometimes trying only the chin strap can be a good strategy, not to start directly with a facial mask. Otherwise, if the patient does not breathe easily through the nose, or does not breathe at all through the nose, and if the age, once again, of the child is bigger enough, you will try the facial masks. And this is a very problem for infants. If they don't breathe easily through the nose, if the nose is completely closed, you won't be able to start CPAP or NIV before they have seen an ENT doctor, so specialist. So that is a point. But for all the children, you can try facial mask, and once again, you have the kind of usual facial mask, That is the old model. And you have this new generation of facial masks that are under nose facial masks. And once again, if there are persistent leaks, very bad tolerance, you can try to change the mask model within the same time, or try to go for the nasal mask if the patient is capable to breathe through the nose. So, okay, we got it. Otherwise, try different models of the same facial. If you have persistent mouth leak, despite the use of facial mask, that can happen. We have one case like this. The leaks were so huge that we need to adapt a chin strap. This is one strategy that can be strange, but yes, you can adapt facial masks like this and a chin strap, and it can work. And the other thing is that if you put a facial mask and you have an increase of upper airway obstruction, that could be because of the facial mask that creates a kind of retrusion of the mandible, so mandibular retrusion. You will have to change the kind of mask and to adapt a nasal mask. But once again, that means that the patient can breathe through the nose. And sometimes, I said, usually, just because you may understand why sometimes you will go from facial to nasal, it's just because most of the time we'll start with nasal mask, but sometimes the patient can feel better with facial mask, even if he can breathe through the nose. So in that cases, that means that he can breathe through the nose. So if the facial mask causes upper airway obstruction, increase upper airway obstruction, you can go and choose to adapt nasal masks.
Sonia, I absolutely adore that diagram, and I will definitely be using it. It's such a useful resource. You highlighted that patients often find it difficult to swap from one mask to another, so that you may use a chin strap if there's mask leak, and that's something that we certainly do. I just wondered what your thoughts are on providing patients with not just one choice of mask, but two, so that they can almost rotate round, and that this gives them more of a security about if the mask needs to be changed, because I feel the pain when I try and change a patient's mask. There is always a big barrier. So I'm wondering if there's something as clinicians we can do so that this is less of an anxiety for them.
We do this especially because sometimes we saw it with the neuromuscular children. They don't want to try anything. They feel good with this small nasal mask despite their very huge leaks. So we give them the possibility to think about it quietly at home and just to try it for one night if they want, and to have the possibility to change at home without having to call us like urgently because there is a problem.
But really, that's fantastic. The take-home message, though, is that your preference is for a nasal mask unless there is a huge amount of nasal obstruction, because we want to avoid the risk of potential vomiting into a full face mask, and also the fact that the full face mask can cause or worsen upper airway obstruction by pushing the mandibular back and making the airway smaller.
Yeah, usually just because, as we saw before, for infants, you don't have facial masks. So yeah. You don't have the choice. You have only nasal, you don't have the choice. So if the nose is obstructed completely, NIV or CPAP is not possible. First thing. And for older children, yeah, usually we prefer to start with very small masks, like nasal masks. But if you know already that you will have a huge amount of leak because of mouth breathing, and once again, because the child has the mouth open even when he is awake, you know that you have to try or the chin strap if you don't have a type of facial mask that exists for the face of this child. or a facial mask for the child, and try to see if this fits correctly. Another point, but we'll talk about this after, I guess, is that sometimes if you want to try to avoid maxillary retrusion, and you have the possibility, maybe the choice will be first for a facial mask instead of a nasal mask, but this is because of another problematic.
Thank you, Sonia.